Hi everyone, it's Dr. Dave coming to you from New York, the epicenter of the COVID-19 pandemic. And I am coming to you because I'm still seeing patients in person and doing telehealth visits, still going to the hospital. And I am getting tons of questions about COVID-19. So one question I'm getting, especially from a cardiology perspective, is are a class of drugs, ACE inhibitors and ARBs, angiotensin receptor blockers, are they safe to take? Because there have been some anecdotal reports that, or I should say theoretical concerns, that these medicines, ACE inhibitors, which are very important for a condition called congestive heart failure and also diabetes and coronary disease, that they can theoretically increase levels of the ACE2 receptor. Now, why is this important? Well, the ACE2 receptor is the COVID-19 virus binds onto a spike protein that then connects with the ACE2 receptor. And this theoretically, if you have a lot more ACE2 receptors expressed, more viruses can bind and enter into cells, into the lung cells in particular. So that's the theoretical concern. But the truth of the matter is, these medicines are so important in so many patients that there's no way we should just stop these medicines. We need to speak with our doctors, our cardiologists, and we need to have a discussion as to the risk-benefit. So it's very important, although we're hearing all this news and media about how ACE inhibitors and ARBs can be dangerous and make people more vulnerable to developing COVID-19, this is not necessarily true. And we should not be stopping these medicines without further discussion. Okay, guys, that's it. Until next time, this is Dr. Dave.